Good afternoon. My name is Vernon Hill. I'm the chairman of the Eastern Shoshone Tribe. And today what I'd like to do is I'd like to talk to you about, some of the work that we've been doing here within the last 3 months to work with the coronavirus problem that we have here. And I guess one of the main things that we have is we have under the Coronavirus Aid Relief Economic Security Act, known as the CARES Act. And what that is basically here for is we're looking at to address the coronavirus when you're looking at prevention, preparedness, and response, to our Indian people. I guess under this, the question on the funding that we did receive from the Treasury, what that is doing, we'll have, the tribes have thought about this a lot, and we're looking at it, and we'll be able to give each of our tribal members about $800 a piece. So, and what we'll do is we're looking at trying to disperse that out in July. So, we're hoping to get that out to the people. What we're looking at mainly is to make sure that we don't get it in the wrong side of the feds there and end up paying this money back. That's what we're really taking a look at. So there's some ways that other ways we plan to use the money is such as weatherization, maybe to help our seniors out that need things such as screen doors, maybe windows repaired, those things, and maybe some delivery vehicles for our tribal health people and our senior program to help get meals out. One of the biggest things that we have right now is that we're looking at reopening of our tribal departments, but that we'll have to extend that. I think the date that we set was June 15th, but we'll have to extend that because of the fact that things that we're going to be putting into our offices, such as plexiglass, we need deep cleaning and other things to be done to our offices. Right now, they're being scheduled so that we can, work around our people before we get them back to work. Once we get them back to work, then we'll probably require them each to have a test in the beginning, so we tested so that the coronavirus. Another question that came out is the use of the Shoshone Rose Casino to quarantine individuals. In our case, and also the Repo Tribe's case, we've utilized our hotel to house some of the coronavirus patients. Is the fact that they had nowhere to really quarantine or isolate away from their family or friends or whatever. So this was being done and able to help them out, our tribal members and that need that care. The only way they get into that is if they had the doctor would refer them to that program. And so if we open a casino, what we're doing is looking at a lot of that will be deep cleaned and stuff before we open the doors for business again. One of the reasons that we did cancel our general council meeting for this month is basically we're looking at, the stay-at-home order. We're looking at the distancing, keeping people away. Because one thing we don't want to do is we don't want to, basically what our biggest concern is the safety of our people. And what we do is we need them to, take a look at that and make sure that they're following our stay-at-home orders and other things that we have out there. Because the fact, this coronavirus is a very serious sickness. And so We've been pretty fortunate right now to kind of, curb that by, doing what we're doing, the quarantining people, requiring them to stay away, closing our offices and stuff, because, it can be contacted by contact. Okay. And so I guess what we're looking at is, what I'm saying is that COVID-19 is still prevalent on the Wind River Indian Reservation. So we need to continue to follow the stay-at-home order. And, just remember that it's in effect yet for the reservation here. And we ask that they follow quarantine orders and wear face masks. And what we're doing is we're talking about, more testing for our people here. That as it comes along, we talked to our tribal health people this morning about that. So if you have a fever or other symptoms, they're asking you to stay home, and you'll be asked to take. If you're most places you enter now, you're asked to take your temperature. Upon entering any offices, but right now we're not open, to visit with people right now or have any people here. So most of that is we're closed at this time. So, okay. All right. Thank you.